Hi, welcome to the Fit and Healthy Today show. Today our topic is peptic ulcers. And what those are, those affect the stomach or the duodenum, and it's an eroded spot. Literally, you have a stomach lining in which a spot gets eaten away. So it's an eroded spot. And under normal conditions, there's a nice mucus layer in combination with certain, as I mentioned here, alkaline biocarbonates that work to prevent the acid from damaging the stomach lining. However, when these eroded spots occur, then they're wide open, and then regular stomach acids or anything that's spicy or is problematic can cause these areas to spread and get worse, or can cause them to occur. What causes peptic ulcers? Stress and anxiety on an empty stomach, bottom line. When you look at that, I think that's probably one of the major causes. They used to think it was primarily H. pylori bacteria, which is also a major contributing factor, but they're finding that stress and anxiety, because when you get stressed out, you excrete a lot of stomach acids into the stomach, and it can just kind of wear away at that lining. Medications such as aspirins, NSAIDs, Celebrex, Boniva, those types of alleged bone building drugs can contribute to that because they cause a lot of stomach acid secretion and upset. I mean, literally, I have customers that cannot take the medication because of all the stomach upset. Even though it's a once a week or a once a month type of drug, it causes them a lot of problems. Black and Latino populations are twice as likely to develop peptic ulcers, and we don't know exactly all the reasons why, but apparently just the types of foods that the genetics have been able to utilize and absorb. When you put them on a standard American diet, it seems to cause a problem with increased ulcer rates. Poor diet, poor nutrition. Nutritional deficiencies, if you don't have adequate amounts of L-glutamine, vitamin C, B vitamins, good bacteria, also known as probiotics, you don't have anything to keep that stomach lining strong. So therefore, when you do have a bad diet or you eat bad foods or you have a lot of stress going on in the stomach, then it allows those eroded areas to take place. Allergies. And I'm talking about food allergies primarily because when you have foods that you're allergic to, they cause inflammation. And when you cause inflammation in the gastrointestinal tract, you get little spots of eroded areas, in this case, your stomach or your top of your small intestine. Smoking and alcohol make the body very acidic, and so do artificial sweeteners. Those types of things raise acidity levels in the body. And there's certain chemicals that are found in cigarette smoke that also make you more acidic. But alcohol, it's a pure sugar. And so when you drink it, particularly on an empty stomach, it can eat away your stomach lining, particularly if you're nutrient deficient. We discussed a little bit of H. pylori bacteria. Now what's kind of funny is we have a lot of people that are on acid reduction drugs. You know, they'll take those drugs that will shut down the stomach pumps of acid. And what happens is these nice stomach acids keep the stomach lining strong, and they also prevent H. pylori from happening. So those people who tend to be on acid redox drugs have a much higher rate of the H. pylori bacteria infestation. The symptoms, a burning kind of gnawing pain, and it's kind of funny because a lot of people will think they're having a heart attack because the pain kind of just emanates. But it's a burning, gnawing pain in the upper abdominal, usually when the stomach is empty or within an hour after people have eaten something. So one of the offending foods that causes them tend to, acidic types of foods, or not having adequate amounts of stomach acids in order to break the food down, so it just sits in there and rots and comes back up again and eats away and forms one of those little ulcers. When we're talking about the right kinds of foods to eat, particularly when you have an ulcer, but these can also be used as a preventative if you've had them before. Tag I met. I've had ulcers many, many times diagnosed, and I always know now when I'm getting one, I pretty much can self-diagnose and know, uh-oh, too much stress, too much something going on here. I got to make things really, really clean, and then we'll talk about the supplements here in just a few minutes. Eating smaller meals with lots of fiber. Fiber seems to be able to absorb fiber. Water kind of dissipates the stomach acids, reduces the inflammation in that regard, and eating smaller meals doesn't put so much stress on the pancreas and the liver and all your digestive tract, so it keeps the stomach where it digests small meals and it's gone. Eating several servings of leafy green vegetables. I got to tell you, I think most people, they're lucky if they eat a salad a day. Leafy greens, all greens, have a vitamin in it called vitamin K. And this vitamin K is very, very important in order for the stomach to repair damage from these gastric juices. If you get an ulcer, there is something that's not found very commonly around, but you can get it, or if you're willing to juice it, you can get it, juice it yourself, and that's cabbage juice. Or if you're like me, last night I made my mom's good old homemade sauerkraut, high in certain types of fermented types of acids, but it's very healing to the digestive tract. So a sauerkraut, cabbage juice, those types of juices are very healing, and you can mix them with a little bit of carrot juice if you want to, because obviously when you're drinking cabbage juice, yummy, yummy, not so great. Mixed with other things is okay. Eating garlic on a regular basis, if you particularly know you tend to have H. pylori bacteria problems, the garlic helps kill H. pylori. Garlic, oregano, a lot of the typical spices, rosemary, those types of things kill the H. pylori and other bacteria that form or that you ingest from a standpoint of illness as well too. Avoid sugar, spicy foods, citrus foods and juices, coffee, black tea, and then we already talked about alcohol. These are all things that are very, very, very acidic, particularly throwing sugar on a wound, alcohol on a wound, coffee on an open wound. You can turn, with these types of foods, you can turn what may be a very minor ulcer, peptic ulcer, into what's called a bleeding ulcer. That's where you could be vomiting, blood coming up, more serious because you're actually bleeding internally and inside. So, if you got an ulcer and you know or been diagnosed with one, stick with good, smaller meals, leafy green vegetables, no juices, no coffee, no acids, no candy, just make it nice and clean. Now, where I've had the best help with me in my fight against ulcers, and my mother included, and who knows whether it's genetic or not. I have a clean diet and I eat clean, but I'm a higher stress kind of person. That good old German heritage is just the way it goes. The number one thing that I found that heals and helps, I know when I have stomach ulcer issues, is licorice root, preferably diglyceride licorice. Diglyceride licorice lowers the blood pressure, or keeps the blood pressure down. Regular licorice can raise blood pressure up. Diglyceride licorice is also very good for the adrenal glands. It's very supportive of that. But 20 minutes before each meal, there was a study, actually more than one study, but studies found that it was effective as Tagamet or any of the other antacid medications at helping ulcers heal. So, before you go out there and start taking an antacid medication, thinning that lining further, and which will allow the H. pylori bacteria to eat even more of your stomach lining away, consider diglyceride licorice. For me, only option. My mom used to do all those acid reflux. She had ulcers 3-4 times. It was a continual problem for her. Mastic gum. There was a double-blind placebo study. What that means is they took two groups. One got the mastic gum and one got nothing, and neither of the parties knew what they were getting. And what they found with a product called mastic gum, and it comes in, it's not a chewing gum, it comes in capsules, and they found that there was 3 times the healing rate as a placebo, 70% versus 22% in the placebo. So very, very helpful with peptic ulcers. Aloe vera. As we know, when we get burns, we put aloe vera on it. Oh, it feels better. It cools the burn. Well, aloe vera internally taking is actually very, very healing. soothing to the stomach. And it's also antimicrobial. It kills bacteria and viruses and fungals and other things, but it can help heal that burning that you've got as well. And about 2 ounces 3 times a day. Probiotics, particularly if you're on an antibiotic, because a lot of doctors, if you get H. pylori bacteria that's causing an ulcer, they'll throw you on an antibiotic, which actually creates even more acids, so it kind of scratched my head on that one. But the good bacteria, lots of studies that supported it, really aided the recovery rate. In one study, it showed 2.5 times an increased recovery and not keeping a reoccurrence from not coming back or not having H. pylori reoccur when probiotics in a minimum of 4 billion of the little critters twice a day on an empty stomach. L-glutamine. Now, L-glutamine, there's a local oncologist I know, Dr. Walker, that recommends it to her patients, her chemotherapy patients that find that the chemo causes a lot of burning and that type of thing in the digestive tract, and the L-glutamine helps heal the intestinal lining. Well, guess what? It also helps heal the stomach lining, and I think Ralph 4 weeks ago or so talked about L-glutamine utilization for ulcers. It heals the lining by actually literally stimulating the cellular production of these mucus lining cells. Heals it right up. Same for the intestines, as and Dr. Walker uses it for chemotherapy patients. Essential fatty acids. Now, these can also be taken as a preventative as well as a treatment. And about 4,000 milligrams, a teaspoon a day minimum of fish oils, flax oils. What that does is that helps relieve or reduce inflammation and also aids healing as well in the stomach lining. There are several homeopathic medications. I wrote the most common one down that's utilized for ulcers called Nux vomica, because a lot of people get nausea and pain associated with peptic ulcers, and so the Nux vomica seems to be able to fight that as well. And homeopathics are one of the American Medical Association's first medications. They cause no side effects and they can be taken with any drug. Golden seal, used for a lot of things, but it's an antimicrobial. Studies supported it as being an excellent way to fight H. pylori bacteria-induced peptic ulcers. 500 milligrams 3 times a day. When you do golden seal, though, I would still suggest doing a probiotic. Bovine colostrum, and everybody's going like, what's colostrum and what's bovine? Okay, bovine is a cow. Colostrum is the first milk that comes out of mammals, including humans. Okay, that colostrum, we can get it in chewable or powders or in capsule forms. When you take it in, not only does it heal stomach ulcers, but it gets if it is bacterial cause, it causes the bacteria to clump off and go through the digestive tract and be expelled. So it kind of clumps them and isolates them so they can't replicate, and it's also extremely healing. It's kind of funny. There is some minor study work that's been done on babies and colic, and when mothers feed their first colostrum. The colostrum is the first, we really call it milk, but the first liquid that comes out of breast tissue that gives you the immune system and a lot of things, and they found a reduced rate of colic. Obviously a stomach condition, and if you're a parent, a no sleeping condition if your baby has it. So colostrum healing as an adult, colostrum healing as a baby. Oregano oil. There's a book called Cure in the Cupboard about oregano oil. Oregano oil is an antimicrobial that kills viral, fungal, and bacterial infections. Very effective if you can get past the taste, but we have them I know at my stores, we have them in little gel caps you can take. It also kills and fights H. pylori bacteria and upper respiratory infections and all kinds of infections. Now, as a preventative, a multivitamin high in Bs, along with taking adequate amounts of A and C. It prevents infections. It helps the mucosal linings to repair themselves. If you're vitamin C deficient, you are not going to repair the lining. It's just not going to happen. I could throw everything at you, reduce the diet, your linings won't repair. And neither will your joints, and neither will your skin, and neither will your vascular system. Our federal government is way underestimated. 60 milligrams of vitamin C, that's to keep you from getting your skin from falling off, called scurvy. But to be healthy, 500 to 1,000 milligrams of ester C per day, and if you tend to have ulcers or immune compromised, you need a couple of times a day. Me as an athlete, I do 5 to 10,000 milligrams of vitamin C a day because it really helps my joints. And I've got a little heart condition, a leaky heart valve, and it supports my valve health as well too. I don't usually name products on this show, but there is a product called Acides, made by a company called Enzymatic Therapy, which you can take if you tend to have excessive stomach acids. That helps balance out the excessive acids in the stomach. Very, very helpful if you tend to have issues with chronic acidity. You know, it's kind of funny, I throw in this little tip as a conclusion. There's a stomach acid self-test to find out whether or not you've got too much stomach acid or too little that's causing your digestion issues. What you do is you take a teaspoon of Bragg's apple cider vinegar or any natural unfiltered raw apple cider vinegar, and you mix it with a couple ounces of water and you down it before your meal or on an empty stomach. If you notice for example, if you notice you ate a food and it's kind of like going, churning in there, it's not digesting, you can take it with that meal. If it solves the problem and your food digests, that means you've got too low stomach acid. If you notice a little burning, it's like, you know what, this is making me more uncomfortable, then that means you probably have a little bit too much stomach acid. It's a really easy little self-test you can do yourself at home. Next, we're going to be moving on to our somewhat childlike fitness program. Thank you. Welcome to the fitness portion of our show, and with us today are a couple of implements of fitness that I the 99-cent frisbee from Limos, and a nice little cheapy jump rope actually that my son pulled out and started jumping all over the place and says, "Gosh, Mom, this feels really good." And I thought, you know what, why don't we show our audience just some basic types of things that they can use at home to exercise with that are cheap and that are really actually not exercise equipment. The good old standard frisbee. You know, I was out with a bunch of Boy Scouts, and the parents, we were aside playing frisbee while the Boy Scouts were doing their thing. And I was having to leap and trying to catch all these frisbees and running and chasing after, and when I missed it or threw it funky, I had to run. This, I found, was actually a really good cardiovascular and overall workout. A 99-cent frisbee. Cheap. Give it a try. It's a lot of fun. The jump rope. Now, obviously, this is one of those little cheapy ones that my little son said, "Oh, I want one, Mommy," about 5 years ago, and then he's never seen it, and then he starts cleaning out his cabinet, and there we go, there it is. So I would get a little bit better quality one, but I brought it in to demonstrate how good of an exercise jump rope is. My gosh, you can look at a lot of the boxing movies. A lot of boxers use jump rope for cardiovascular conditioning. And, you know, it's kind of funny, I kind of played with this a little bit because I hadn't jumped rope in a long, long time. And, you know, we used to do the double dutch and all that kind of stuff when I was a kid. And I remembered my 84-year-old grandma, when she was 84 at the time, jumping with my 6-year-old son. She was jumping rope, regular jumping rope. And I'm like, gee, when I grow up someday, I'll be like my grandma. I thought, you know, hey, why can't I do it? So the basic movements of jump rope, you know, just the standard like this. Okay, and you can do funky little things like cross it, and hopefully you don't miss it, make a fool of yourself. Or you can jump like this. But what you can do is you can make it light and easy. But simple, basic little things. You can get cheap little rope, whatever you can. Jump works the lymphatic system, moves things along, and it's good cardiovascular. Anyway, next we're going to be moving on to the research portion of our show. Thank you. welcome to the research portion of our show, and with us today is Ralph Turchiano. Ralph?
And thank you for the intro. Well, from a place we haven't heard of probably since In Search Of was a TV series, a little known substance came off the island of what's called Easter Island. Well, a few innovative scientists discovered there were some unique properties to a dirt on Easter Island and decided to call it rapamycin, which basically is a takeoff of the old island in Easter Island called Rapa Nui, if I'm pronouncing it properly. What this dirt did, what they discovered, is when they fed this dirt, they had to micronized it first so it was easy to digest. When they fed this dirt to mice, not young mice, actually fairly old mice, the equivalent to what would be considered 60 years of age, when they fed it to them, it extended the life expectancy by an average of 28 to 38%. The reason that's important, it's one of the first known substances that will actually dramatically increase lifespan even at the later stages of life. Pretty amazing all the way around. You may also find the rapamycin sometimes in some forms of medication, but this is something coming from Easter Island. Interesting. After that, not to keep on ragging on China and Chinese imports, but there's another import from China you have to be really concerned about, called clinical trials. What Biomed Central did is they went and looked at the clinical trials, what was considered what's called randomized control trials, RCTs, which are supposed to be the gold standard for clinical trials. They went and looked at 2,235 clinical trials from China. What they discovered was this, that some of them were kind of inaccurate. Well, you could say, well, how inaccurate? 10%, 20%, 40%, 50% sounds a little bit absurd. 70% I'm making up stuff. Well, guess what? The number which it is, I could not make up. 93% of the 2,235 clinical trials were not done properly. In fact, they should not even be considered clinical trials. This was done in combination with the Chinese Cochrane Center at Sichuan University in China. They looked at the clinical trials for 20 common diseases. 93% of them were wrong. In fact, they said, quote, the authors, that these trials present mostly positive results favoring the treatment being investigated. So if you're a drug company, you want a positive result, go to China. You want good information, good science, don't go to China. Something just to keep in mind. And now, another medication, statins. Just a little side note. Canadian Medical Association Journal took a look at basically a few individuals that were taking statins, actually 83. They wanted to see what was going on. Well, in all 83 individuals that were taking statins, they said they had pretty significant what's called myotoxicity, muscle damage. But the part that was concerning them most is not the fact that the statins caused muscle damage. It was the fact that when they went off the statins, the damage was persistent. Even after they discontinued the medication, they had persistent myotoxicity continuously, regardless of how long they've been off the drugs. So I'm going to start looking at subgroups of people which should not be taking statins at all. And this leads into the prior story. Acid-reducing medicines may lead to dependency. Well, what they decided to do at the Bethesda, Maryland, is they took a few individuals who did not have any heartburn and gave them heartburn medications for about 8 weeks. Then they took them off. Well, guess what? 40% of the healthy volunteers started having persistent heartburn, even though they never experienced it before. After 8 weeks of basically these antacids, they could not get off of them. What they called it was rebound acid hypersecretion. Something to think about. If you're on an antacid, temporarily, maybe. Do not become addicted to it. They found out 33% of the people fulfilling prescriptions for antacids never needed them to begin with. All right. After that, we deal with preterm births. Coming out of basically Cincinnati, this is in the Journal of Pediatrics, they looked at the blood chemistry of children which were preemies. They found 70% of them had quantifiable levels of phthalates in the bloodstream. The reason it's important, because preterm infancy is under the age of 5 is one of the leading causes of deaths. The United States has one of the worst infant mortality rates in the industrialized world. Here the next. Those. You ever hear once in a while, I want to get some kidney screening done on you and see how you're doing? Well, those little contrast agents that they give you so they can get a good shot of your kidneys create some pretty significant damage. This came out of the Clinical Journal of the American Society of Nephrology. What they discovered was this. Out of the 294 patients they looked at, 92% of them, 31%, suffered from damage. What they said was, quote, 31% of the patients experienced negative health effects. 13% of those patients experienced a major event. What's a major event? Stroke, heart attack, death, end-stage renal disease. The reason it's important, because most doctors tell you that any side effects from contrast agents are temporary. Well, there's 31% of the people which stand out are not. After that, coming out of Tel Aviv, interesting article called Your Arteries on Wonder Bread. The reason this is important, they found out when people ate white bread and any sort of refined flours, it contributed what they called was endothelial dissension. I can't pronounce it right. They found that when these foods were consumed, the high glycemic index caused what they called distended brachial arteries for 7 hours. The reason being was this constant distension causes the arterial veins to lose elasticity. Why is it important? It's important because of this. They said, quote, unquote, this is from Dr. Schechter, endothelial health can be traced back to almost every disorder and disease in the body. It is the riskiest of risk factors. The placebo group they had no problems, but the white bread groups, major problems. And then I want to finish up with this, prostate screening. Do you realize that no major medical group, including the American Cancer Society, currently recommends routine prostate screening for men at average risk? Well, recently, this is in the a cancer journal for clinicians. They looked at 2 large randomized trials, and they discovered this. They said that most cancers which they caught are clinically insignificant tumors. They also said that most of it was overdiagnosed. How badly overdiagnosed? 29% for white Caucasians in the United States, 44% for blacks, 50% for people in Europe. All overdiagnosed. Why is that important? Let me give you a little statistic. They say in 1985, before PSA screening was available, an American man had an 8.7% lifetime risk of it and only a 2.5% chance of dying. After 20 years, you have a 17% chance being caught with it and a 3% chance of dying. Thank you very much, and I'll wrap it up.
Thank you very much, Ralph. Once again, all the information we give you, research, look in for yourself and do the best you can to take your health into your own hands. Thank you very much.